Brought to you by River State Government, the treasure base of the nation.
Welcome back to Eye on Rivers. The River State healthcare sector has experienced several changes, which include the establishment of over 100 primary healthcare centres and the employment of over 200 nurses and doctors into the system. Join us as we take a look at what other developments have been taking place in the sector, as well as discovering the challenges facing it. Stay tuned for more Eye on Rivers. There are, however, still strong sentiments that more needs to be done. For those working within the sector, the improvements in terms of infrastructure and facilities are significant milestones, but they are still faced with manpower and electrical issues, to mention a few.
Our basic challenge is definitely we would want the government to employ more people. We have staff, but we would always welcome more staff. We always welcome more people in the health sector, because the health sector is something that is growing, and with this free medical care, there are a lot of people that are now attending the health facilities, and so the previous staff strengths, and since more people are visiting the health centers now, so we need more people. And we also would appreciate if we have regular power supply, because we burn our diesel and all of that. So if power is stable in the state, it will also help us.
Really, government is trying, but the only thing I will tell them is that they should look more eye on this free medical, so that we will not lack drugs. We will not lack drugs, and the people in River State will continue to benefit from it.
The major challenges we have in BMSH is space, lack of space. As we know, every facility has a limit. But with the programs that we are running in the state, especially the free medical, and being the referral center, the influx of patients overwhelms the hospital, and that's the major part of our problem here. Then we are not autonomous. In BMH, we run the system that affects every other hospital, not taking into consideration the size of BMSH. It's a specialist hospital, but most of the programs we are still running like that of a general hospital. It can be upgraded to really be a specialist hospital or even a tertiary center.
The issue of manpower here, I think to us here, it's not being fair that even the whole system, the entire government itself, with all the series of employments, has been carried out in the state. The issue, especially in this health sector, the last employment made, no medical laboratory scientist was employed. And it's a serious indictment. Everybody's talking about development, manpower and everything, but onto us here, we are marginalized to the barest, to the extent that we see the work pressure that comes in BMH. You understand? On daily basis, increasing by the day with the inception of this free medical. So we are being pressed with excess work. Look at the time now. I'm sitting in the office, seriously working, making sure I round up the day's work so that by the next day, patients come and get their results. You understand? I work hard myself. And when we have an opportunity that, employment has come, especially now we need more hands, we'll get more hands to support us in these services.
River State citizens are also not entirely won over by the current workings of the healthcare sector. They too feel that certain issues ought to be tackled.
I see the doctors and the nurses at the lab. We have so much crowds here due to this place, Port Harcourt Center. And what they needed to do, if they can as well help us to top more houses up here, then employ more hands. We have other doctors, nurses that are looking for jobs. They are all graduates. Because most times due to this place is small, and the doctors are doing their work. So sometimes they get tired easily. Like me, I'm carrying my scanner here. I was admitted. But what actually happened, after 3 days, I was asked to go back to the house. I come from the house for my injection daily. And I have a neighbor also that they just operated on. After the operation, they asked her to go back home. She comes from the house for the dressing of the wound. So I believe they should help us put more housing and also employ more hands.
My mom was admitted here
for about 3 weeks. And we've been getting our drugs from the hospital, from the pharmacy here. But when she was discharged, we went outside to get those drugs. I was so shocked to find out that one of the drugs was about 2,000 naira more than what we bought outside. So theirs here was more, I'm saying 2,000 naira more than what we bought outside. So we are even feeling that it should be cheaper here and not to be so expensive. And sometimes too, like for those in the free medicals, you find out that even the drugs they should be giving are not here. So is it because they're on free medical and those drugs are maybe intentionally left or are not put in here for them to have their drugs? So if they're on free medicals, I think the essence is for them to have these drugs regularly because they cannot afford them. So they should look into that, especially the price regulation. They should look into it. Why would their drugs be 2,000 naira more than what we get outside?
While those working for and benefiting from the state's new healthcare policies have their reservations, this does not go to entirely negate the efforts of the government so far. Like any growing sector, Rivers State healthcare sector has seen its fair share of improvements and challenges. And while it is still growing, one thing is certain: there is room for investment and the private sector is participating.
We have outsourced those 2 hospitals. 2 reasons. One, we want them to be properly maintained to international standards and deliver international standard medical care to us. We also intend that these facilities will train our local workforce for us, will generate local manpower for us. It's another way of, will I say, stealing technology on the other hand. As I know that technology is not given free of charge anywhere. That is our way of technology transfer, attracting some of our doctors in diaspora to come back because we want to create the enabling environment for them to work back home.
The Pan-African Health Foundation Auto-Disable Syringe Factory is one example of such partnerships. Completed and commissioned in late 2008 and accredited by WHO QS, the factory produces 160 million syringes per annum and is being expanded to produce 1 billion annually, among other products, in order to improve its competitiveness and long-term commercial viability. The projected cost of the expansion, which is set to begin before the end of this year, is $280 million.
It is good news that today, the National Primary Healthcare Development Authority, they want to have syringes, 0.5 mil syringes, WHO pre-qualified. That means all over the world they can access it, want it and use it. They send inquiries to Port Harcourt, say we want to buy your syringes to do our immunization program this year. It's a good story. Either you have to go to the Americas and wherever, China, to get these things down. The other day, UNICEF sent an inquiry that we should produce 0.25 mil syringe, which is a new one. They did that because we have a standard, international standard factory.
We are currently employing 130 people in this, our present factory. We are now starting expansion project. We have already started clearing land here around the factory. And we will employ 2,000 people at the end of that project when we start operations. So we are having a great impact on employment creation in the state. We are also producing vital medical devices, 80 syringes that save lives. We are, in the expansion project, we are going to produce additionally IV solutions, IV giving sets, and water for injection, and so on and so forth. So the vision of River State government is to improve life of people here by creating employment, by improving healthcare, So we are a good example of that vision.